In this episode, we talk with Rohit Nambiar, co-founder of SabaiHealth, former CEO of AXA Afin and Tune Protect, and author of The Simplicity Trap. We discuss how AI is changing healthcare, why SabaiHealth chose messaging platforms over a traditional app, and how regulation, data, and rising model costs shape the product. Rohit also shares why he believes better access to health data will make patients more active partners in their own care.
Welcome, everyone. Today on the show, I'm really excited about this. We have the founder, CEO of SabaiHealth, Rohit Nambiar. Rohit, welcome to the program.
Thank you, Hunter. It's a pleasure to be here.
So I like to start off with the same question and then just see where it takes us. So to start, tell us your origin story.
Well, I was born in India. I lost my father when I was young. So I had an extremely inspiring bunch of women in my house, my mother and my two sisters to look up to. They were much older than me. My mother went back to school, finished her master's, and grew up from being a school teacher to a principal. So I don't need to go for motivation elsewhere. And then, I started in India with AXA. I was with AXA for 17 years. I moved around with AXA into UK, then into Singapore, Hong Kong, and then eventually Malaysia. And then I moved to another insurer called Tune Protect, where I was their group CEO. And then I took a break. I just felt I needed to reoriginate myself, reskill myself. And I came to a conclusion that AI is to mankind what tire and fire is, fundamentally going to change what we do, how we do. So I went back to school, went back to studying, went back to doing some advisory work, went back to getting my hands dirty before we co-founded this company. The idea came from one of our co-founders, San, and we are about 4 of us who co-founded SabaiHealth.
Got it. What else did you do on your break besides re-educate?
I'm a little bit of a maverick. I like to put myself to some goal and then go behind it. So I obviously climbed Mount Kinabalu, which is one of the largest mountains in this part of the world. I did a triathlon. When I was in the US, we hiked Yosemite and we did the Oregon National Park and some of those stuff. Played a lot of tennis, watched a lot of tennis, watched the US Open finals that year between Taylor Fritz and Sinner. So my mother was getting worried saying, what is this guy doing? Because during those times they don't take such breaks. So she's like, aren't you going back to work? I said, no, I'm on a break. So until my mom said, I've had enough of you, go back and work. Because I was in the US. I spent quite a bit of time with her.
Got it. That sounds like quite an adventure during the sabbatical. So you went from being the CEO of an insurance group to a startup. And so you were in the corporate world for a pretty long time. What made you decide not to go back to corporate work and instead found your own company? What was the genesis of that?
Actually, after the break, I was starting to have some conversations with companies again to go back. And when I had those conversations, I must admit, I didn't feel inspired enough to go back. And I was like, am I going back to the same thing where we're going to have, it's also the spine of the book that I've written, Simplicity Trap. Complicated, complex organizations, boards that are out of touch with, reality. And so I told my wife, let me try something else. If it doesn't work, I can always go back to my, comfort zone where I've built my career and might as well go try my hands at something which is different. I didn't start as a CEO for SabaiHealth because I was not convinced, and so was my other co-founders, needed some time before we could really be convinced that I could really work in a startup because everything changes, as you know. from having a chief of staff to a driver to a personal assistant to now having no one. Somebody asked me, how does it feel? I said, very liberating, except when you have to park the car in Kuala Lumpur. It can be a pain sometimes, but otherwise, it's liberating. It's different, but it's liberating.
Yeah, all of a sudden you're the janitor also. Right. So, yeah, let's talk a little bit more about your book. What's the thesis of this book?
That's my book.
Simplicity Trap.
No, the genesis or the kind of origination, the spine has always been, I've always said that to make things simple is very complex in regulated industries like insurance, banking, healthcare. Because when you make things simple, you kind of have no place to hide. You kind of have to sit behind your own decisions and be responsible for it. It kind of sounds weird, but not everyone wants that to happen. Making things complicated on the other side is actually very simple. You just have to put a few of us in the room, and all of us like to add stuff. But removing is a very difficult act. So that's why I call it complexity is chosen and simplicity is an act of courage. So through the years at AXA Affin and AXA and Tune Protect, I was lucky to work with a very strong team where we launched several industry firsts. We were the first insurer to launch telematics in Malaysia more than a decade back. We were the first insurer to launch RPA at scale. So we did pretty massive transformation RPA 10 years back, which is now in its new form AI. We were the first insurer to put core systems and all the systems on cloud. It took us 11 and a half months to get approvals from the regulator. The next insurer got it in 6 weeks because we were the first crazy guys. They were learning as much as we were learning with them. We were the first insurer to launch online health insurance as well in Malaysia. But along the way, I had some failures. I set up a life business in Tune Protect. It didn't work out and we had to shut it down. There were some other stories I talk about in the book. When I first launched RPA, the first project was a health claims project, and we were able to automate significant amount of processes, and we were able to re-originate almost 12 resources, etc. The second process we executed was in finance, and our robo ended up duplicating 3,000 invoices and also paying the amount. And next it was a small amount, but it's still a financial loss. It has to be reported to multiple, committees and what happened and stuff. The next the tech team is to blame. They don't understand anything, and then you realize, oops, what went wrong here? So there were clearly some learnings there around executive sponsorship, around garbage process, garbage output. I think those are things we all know. And that kind of taught us a lot on what to do. So after that, we only did RPA once we applied lean. So we made lean a precursor to any RPA process. So again, that's kind of what this book is about. It talks about those successes, those failures I've had. And a big part of those success was the team and the kind of culture we've built as well.
Got it. So let's talk about SabaiHealth. What is it?
So SabaiHealth is essentially trying to solve two pain points. One, what we're saying is general purpose LLMs were never meant to be built for health and wellness. Second is when you go to a clinic, when you work with an insurer, the engagement level is extremely poor. Today, most health tech apps in the region have an engagement of about 8 to 12%. If you go to a clinic, if you go to a hospital in most parts of the world, it's more predominant in Western geographies when it comes to availability. It's more predominant in Eastern geographies when it comes to accessibility and availability sometimes. As you walk out of a hospital, nobody's there to remind you to take the medicines. Nobody's there to check on whether you have side effects and whether you've heard news stories from people and so on and so forth. Now, where we come in is we built it on WhatsApp, Line, and Telegram. So it's a message first, no mobile app, no downloads. It's simple. You can send text, you can send audio, multi-language. In Asia, that's a big thing, Southeast, in Asia, America, Africa. So you can send audio, you can send text, you can send images. And then over a period of time, it understands you with the memory vault. So for example, when I send it a picture of a meal, it told me two things today. One, it said, hey, with your high protein, low carb diet, this is probably on the higher end of your carbs. And second is, with your irritable bowel syndrome, the sauce, you may want to go slow on it because it may, impact. So it knows, it learns me, it teaches me. So obviously with a new user, it lasts with a bunch of questions. Doctor in the loop is a big part of it. So obviously we connect into clinics, we connect into hospitals in the countries we are building. The whole idea is we are not a doctor. We're a care companion which lives on the easiest messaging platform that you're using today. And we want to service you. We want to be there with you and make it as simple as possible. So that's really the thing. Of course, we've been doing stuff. We've done a very good pilot with a government clinic in Thailand. Some good pilot results that came in. We've also done the USMLE exam, which is the medical examination that even the LLMs have taken. Most LLMs are between 90 to 96%. We scored 97%. So obviously those things we are doing. But I think more importantly, I'm a firm believer that technology is commoditized. It's about how it's used. It's about who is using it and how easily can you get it. So for example, our wearable connector is so simple. You just type on WhatsApp, connect my Garmin, and it'll tell you how to connect your Garmin. We're using a technology from Rook. We're now building a new functionality called period tracker because we notice a lot of our users are women with hormonal health challenges and they use other mobile apps. So the idea is you don't need to have multiple apps, one for tracking your steps and heart rate, another one for your food, another one for your health reports. Put it all in here and you have one place where you can manage the whole thing.
See, so as a user, does it have access to my medical records? Like if I have a treatment plan provided by a doctor, am I uploading those into WhatsApp, or how does it learn about me kind of on an ongoing basis?
So two things. If you are connected to a hospital network, then we will, provided all the PDPA rules and the necessary approvals are got, we will connect into the database. But as you know, most hospitals are not very open to that conversation. So when it's not, then obviously you will need to upload the reports.
Okay, makes sense. How I'm seeing this in kind of my line of business. We both work in regulated industries, which is an additional challenge, right? Compliance is like, we spend more time on that than almost in building. Generative AI is new. Large language models are relatively new when, you look at the compliance and regulatory landscape. Are you seeing similarities to when you moved to the cloud 10 years ago where even the regulators aren't quite sure yet and are still kind of learning on the job? Like what is the regulatory landscape like around large language models and generative AI more generally?
I think it's evolving across the region, as you rightly said. I think the regulators are learning. In my view, there seems to be broadly 2 to 3 approaches. One set of regulators who are just waiting and watching. The other set of regulators who've gone out and taken some decisions. One of the most difficult ones is we are starting to see some, they call it discussion papers, and I'm not naming the countries, around data residency. It's going to be very difficult with LLMs to have data residency. You can have our data local, but you're still using LLMs, which are, not necessarily going to be bound by your definitions. The third part is we are obviously seeing some regulators who are being quite prescriptive in terms of what you can do and what you cannot do. In general, emerging countries are still behind the game on the mature countries. So obviously in the US, anybody today developing would have HIPAA and high trust. We don't need that in this part of the world. It's more PDPA, and you evolve towards that. That's the next level that you need to have. But I think all of us are learning. I remember when I started the cloud journey, there were 3 promises made to me by everybody. Cloud is going to make it very flexible for you. Go-to market's going to become much faster. Second is cloud is more secure than obviously on-premise. And third is it's going to be cheaper. The first, absolutely true. My products where I was able to launch products faster than most people. The second, of course, you're more secure on cloud versus on-premise in your own systems. The third was a complete bogus, right? My cost went up 4 times. It's the same with tokens that we are realizing now. A lot of CFOs are talking about the concept, which I heard when I was in MIT this time, around should you include token in your labor costs? Because you're automating processes and getting rid of people, but essentially your token costs have gone up. So what does it mean? So again, there are new dimensions that are coming in as well, to your point. So from a thinking perspective, it's the only thing we can do at this point in time is to be as nimble as possible and not commit ourselves to anything long term at this point in time for 2 reasons. One, regulation can come and change things pretty drastically. Second is technology is changing so fast. If you asked me in last October, November, would most of my things, my operations be not the analysis, the operations be run on cloud, I would have said, really? And what happened in the first quarter this year, Claude just completely upped the game. Most of us went in on Claude. Now we are starting to find ways of optimizing Claude because, Claude is not the best when it comes to token costs. So suddenly we are, for a startup, we are having bills which are pretty sizable and unacceptable. So we're looking at, hey, how do we optimize these things? So there are different options we look at, including Open Router and, the Chinese models and all of that to see how we can, optimize how we do business.
Yeah, I got my first 5-figure token bill last month. That was unpleasant, to say the least. So you mentioned a couple times now, your history with being an early adopter on cloud. You're also struggling with token costs like everyone else right now, right? It's just this new line item on your P&L that like wasn't a thing a year ago, and now all of a sudden it's like a pretty significant thing. Do you think so? Back then, let's call it, you did the cloud migration 10 years ago. Let's call it 8 years ago, 7 years ago. The consensus was everything on the cloud. We're going to put everything on the cloud, right? And I'm wondering if you are starting to see the pendulum swing back a little bit to on-premise, particularly around, managing token costs, right? If you buy, some GPUs and then have an on-premise machine, then you can just pay for the electricity instead of paying for tokens in some cases with the open source models, the Chinese models, etc. Do you think we're going to see like a kind of a resurgence of on-premise solutions as a response to token costs and generative AI in general?
I heard this from a couple of the CEOs and a lot of the conversations around a lot of the internal stuff they're talking about moving it on premise and keeping the customer related stuff still on the cloud. Also because of lack of discipline when it comes to data management when it's on cloud. And a lot of your users, listeners may not remember those times. I lived those times when I started off my career where tech used to say, okay, clear your folders. We're running out of space. We used to get these emails saying, you got to clear your space. You got to clear your space. But honestly, a lot of it also was driving user behavior to say, are you looking at your duplicate files? Are you dumping stuff in there, etc.? So coming back to the conversation on in-house and internal and external, I think there are organizations looking at whether they need to use on-prem for internal data and cloud for external data. It's a bit like what we did in the token side. In Sabai, what we do is we have a multi-LLM orchestrator. So we have 3 levels. The first level is the retrieval layer. So that kicks out any hallucination, not any hallucination, limits hallucination. And also, one thing it does quite well is it will not entertain things it shouldn't be. So if someone says, I'm bitten by a snake, it's going to say, go meet emergency. There's no conversation with a bot. The second layer is our RAG, which has its own set of rules, etc. The third level is an LLM orchestrator. Why do I give this example? What does the LLM orchestrator do essentially? If it's a very simple query, it goes to DeepSeek. And obviously, that's one of the reasons why my token costs are quite efficient as of now, because a lot of the simple query, it goes to DeepSeek and potentially other Chinese model. Now, when it's more complicated, obviously it'll go to other higher value, LLMs. I mean, med level LLMs, including DeepSeek's R1. DeepSeek also has another one, or Med Gamma or Claude or whoever the case may be. And then if it's even more complicated, then it applies PubMed and other data points as well. So again, that's also part of what we had to do to be efficient as an organization. And I think organizations are going to become more and more creative in this side.
So today, what model is, let's call it, the highest quality when it comes to personal health and wellness? What's best in class?
So obviously we would like to believe Sabai, because we pick, the best of different worlds. If someone called us, we shouldn't say it, it's a different brand. Someone recently said, are you the Perplexity of health? And we said, no, Perplexity themselves are launching health, so we can't call ourselves the Perplexity of health. But essentially, that's the model, right? You're picking the best of different worlds to give you the right response by applying our insights, our triage process, our literature, etc. on top of it. But to come back to your question on health, I don't think there's a clear winner as yet, because they're all evolving. ChatGPT came out of the blocks, and then Perplexity came out, as you know. Gemini has been improving a lot. If you ask me, as a base model, I still think Gemini is up there. But Claude, GPT, Perplexity are there and thereabouts as we speak. For us, as they get better, great for us, because essentially they are an input to me. So somebody told me, hey, ChatGPT Health is coming, they're going to wash you off. And I said, first things first, our model is 70-30. 70% of our business is expected to come from B2B and B2G, which is government and business, 30% B2C. I know B2C, we don't have the budgets or the marketing or the sheer presence that they have. Hopefully that changes in some of the other markets. But for us, if they get better, that's great, because the minute the base model gets better, my orchestrator is getting better, because it's going to pick. Today, only 4% of my query goes to ChatGPT. Maybe tomorrow, 15% will go to ChatGPT. It doesn't matter for me. So that's the whole idea.
Makes sense. You mentioned earlier when discussing your product, a choice that a lot of, let's call it, health tech companies don't make, which is you didn't ship a mobile app, right? You're in WhatsApp, you're in Line, you're in chat platforms, right? You're a chat app, basically. Walk me through that decision. What made you guys go in that direction? Do you think it was the right decision?
The right or wrong, time will tell, But I think there are 3 elements to this decision. One is users are today in large parts of the world completely on these message platforms. If you look at Malaysia, it's WhatsApp. If you look at Thailand, it's Line. If you go to the Middle East, it's Viber, and so on and so forth. So people are used to these message platforms. Downloading a mobile app is a different story altogether. And I've been there. I've worked with health tech platforms in my past life as a CEO of insurance companies as well. And one of the massive challenges we had was to make people download their mobile app. One. Two is after that to make them register and go through the process is a massive challenge. And three is, for them to each time go back to their app was a different story altogether. You have to do push notifications, then they get annoyed, etc. Here it's on WhatsApp. We can actually do medical reminders on WhatsApp. We can do notifications on WhatsApp, although it may not pop up, but it'll still appear like a WhatsApp chat. And we also have our own challenges. Only 42% of our users in, say, Africa and Southeast Asia is 32. India is 14% of users who come to the funnel actually cross the consent process. They don't even want to click 3 or 4 questions we ask to give consent before you move to a chat. They get annoyed. Right? So you can imagine the friction that a mobile app is going to have versus a messaging platform where I'm just asking them a set of 4 or 5 questions and they already get irritated. For us, the onboarding becomes essentially much easier. The engagement becomes easier. The fact that my engagement rate is 32%. And as I said, the average engagement rate of health tech apps are between 8 to 12%. There are some who are higher. Invariably, I ask them, how much vouchers did you throw? Because I've been there. The vouchers is the one who's bringing them to higher double digits. It's not sustainable. We don't do vouchers. We have 0 vouchers at this point in time. Now, coming back to your point, it's also a question of how else can we engage them? And for me, these message apps are great because they use audio. Many people naturally use audio, multi-language. There's all kinds of language people are using. There's people who are comfortable with text. There's people who just want to upload reports. It also becomes a private space. You look at our top 3 queries. Our top 3 queries, first biggest use case is chronic care. People who have hypertension, cholesterol, diabetes, they use us regularly because A, they want to ensure they take the medicine. B, they are worried about their diet, their nutrition, etc., etc. There are a bunch of medical reports, glucometer reports, etc. to upload. B, we have people who are on wellness nutrition journey. Hyrox seems to be the in thing now. So a lot of people want to get on this Hyrox journey. So they want to put a plan, etc. C, we have people who just want to send a bunch of medical reports, make some sense to give them some insight. But we're seeing 3 emerging use cases. First is mental health. Second is sexual health, male sexual health. And third is female hormonal health. And we can see why. Mental health is still not something people in emerging markets discuss easily. Sexual health is not something men easily discuss with somebody. And hormonal health, women, is not something they discuss. So here they get their own safe space in their own WhatsApp to have these conversations. And that's the whole idea. And because we put EQ over IQ, that also plays a very different game because hopefully the difference you see is we don't respond like a bot most times. There are sometimes a bot reveals its identity and responds like a bot, which we continue to keep fine-tuning. But the idea is to respond like a human.
I want to drill in on something you mentioned there. You're talking about, mental health, hormonal health, sexual health. You've spent time in the US and you're in Malaysia now, and you've been a lot of different places over your career here. I think some would say that the stigma around those 3 is not there in the US as much as maybe even 5 or 10 years ago. Would you agree with that? And the follow on is, in these other parts of the world that my listeners are less familiar with, is the stigma a lot greater than what we see in America?
For sure.
It is.
For sure. It's changing in a small way, definitely. But it's for sure a massive stigma. It's not. So my son has a sports psychologist. is not because he plays he's a wannabe tennis player. Now, I'm not saying he's, but we felt it's something we should give him access to pretty early. It's not something the other, friends or parents really understand. I've had one or two of them actually come and tell me, really, you need a psychologist? I think you should be doing that job. And I'm like, okay, fine. I hear you. Maybe there are some parents who are more efficient than me, but I think it's always good to get an independent external view. So it's still something that today someone was telling me that if you're seen around a counseling clinic and somebody takes a picture, it's still considered as you have a mental illness. It's changing, but it hasn't changed. Men's sexual health is not something that's easily discussed. Not at all. In fact, it's very interesting. We were in the countries we saw a particular country where there was a lot of men's sexual health questions coming in. And then we sat with the committee and analyzed. We don't get individual data, aggregate data. We analyzed what could be the reason, where is it coming from? And I think part of it is we analyze it's not sexual health, it's actually mental health. They just didn't have a place to go share their frustrations, their emotions, their feelings around it. And suddenly they found, on WhatsApp, I can just keep sending audio messages to someone and, it's giving me pretty decent responses. So let me do it. So I think that's the whole point here. But also, somebody told me the other day that I sent a bunch of reports to a particular LLM and I asked it for a particular solution and it gave it to me. And Sabai refused to give it to me, And I said, but that's exactly how Sabai is designed. Sabai will never tell you this medicine you should take or this is the treatment you should be taking. It may tell you these are the options you should be exploring with your doctor, but it would simply not give you a solution. Because we are very clear, we are in the intersection of supporting what the healthcare system is trying to do, and also we are doing as individuals to have a better, life quality, and not doing what somebody else should be doing. Now, there's a debate on, the quality is improving so much, it may change in the future. That's for a whole new field to decide. That's not the space we are in.
Does your mother understand why you got a sports psychologist for your son?
I think because she's a school teacher, principal, etc., and she understands how the world is changing now, I think she's a lot more open to it and she understands it. But yeah, it's not an easy topic. It's still a evolving topic in our part of the world.
To zoom out a little bit, is there a technology that you're watching closely right now where maybe it's not quite ready for Sabai or to make its way into your product, but when it is, you're gonna pounce on it? Like, what are you watching? What are you keeping an eye on in the tech space?
I'm watching two things. One is not related to Sabai. It's just me as the guy who's interested in it. I'm definitely watching the humanoids. I'm watching the robo space quite closely, because I do believe someone told me this recently and I think it's such a fair point, that any technology has only progressed human beings. Yes, we've had our fair share of challenges on the way. Like AI is going to definitely have some challenges around what are we going to do with those people who only know a certain style of work and aren't ready to do anything else. But that aside, it's only going to progress the society. Healthcare has only increased lifespan for all of us. Yes, there are still people, having cancer and all kinds of ailments, but the fact is, the general life expectancy has gone up. The general quality of health has gone up. So coming back, why do I say humanoids? Because for me, I think in the future, people are going to get older, people are living longer. And the old society that we had in large parts of, at least in Asia, where the children were responsible for taking care of the parents is not going to happen. And most of the people don't have kids today, and who's going to take care of them? Everywhere the population is plunging. So I do believe that humanoids might naturally become, in the next 30-40 years, a key part of old age care. And so I do look at it as a big area of development. For Sabai, I think what we are looking at is obviously companies like Open Evidence, because today Open Evidence is not allowed to. We are not allowed to access Open Evidence. Only doctors are allowed to. But in the future, as those technologies cross a little that threshold where it could almost be accessed like a LLM. If that happens, that's going to change the quality of what we produce significantly. Now, we are an engagement layer. We are very clear, right? So for us, it's a partnership model. If somebody's a telemedicine player, we'll tie up. If there's a hospital, we'll tie up. If there's a pharmaceutical, we'll tie up. That's our idea. So if the base model accuracy goes up because of these kind of, like as an example, I told you about the US medical examination and we scored 97%. Open Evidence is 100%. So obviously it's going to change my game significantly if I get access to it. So I think that's the space I'm watching. It's going to take some more time for sure. But I do believe it'll happen. I do believe it.
So last question, and then we'll wrap up. You mentioned 30, 40 years. I don't think anybody knows what 30, 40 years from now looks like. We'll be on Mars, but let's scale that back. What does like 3 to 5 years look like in healthcare in Asia, let's say? Like, what's your vision for where we're headed with healthcare specifically?
I think suddenly we have the power of data in our hands. We never had it all this while. We used to live in a system where the healthcare reports were not even given to us. If they are given after the doctor looks at it. The doctor spends 5 minutes, tells us, okay, this is what you need to do. And then we come back home and then we go to Dr. Google, search all these things. And then we have all these things running in our brains. I remember when I had my sinus operation about 5 years back or 4 years back. I remember in the midnight, I was Googling some symptoms. And the next day morning, I messaged the doctor saying, I need to come and meet you. Because Google says if I have neck pain right after an operation, it could be meningitis. Maybe it's, and there's some water in your nose, it could be meningitis. So I freaked out and I said, I need to meet you. And the doctor said, you cleaned your nose, so there was some water left. That's it. There was nothing else to it. So obviously there's some water stuck in different places. But my point is not that. My point is that's the world we lived in, from no data to having data that wasn't reliable. But now suddenly in the next, I don't know, with the speed we've seen this 3 months, this 6 months, this year, as you said, 30 years, 40 years is just a statement. In 3 years, 5 years, even 1 year down the lane, maybe it's going to change. But the amount of data that I have access to is going to change fundamentally. So healthcare is going to become very much a partnership discussion, in my view, where the patient is very much part of his journey. And the doctor is obviously heavily involved in where they want to go, but the patient's aware. And you can make sense, because sometimes we hear these statements saying, my medical test is pretty decent, my heart rate from the wearable is decent, but I had this problem. Now, that's because all the data is residing in so many different spaces. And I think that's the biggest benefit I feel that we're going to see. And that's where I hope Sabai, and I'm sure there will be other competitors. And as my co-founder always tells, more competitors means this is a place where there is an opportunity. I hope we can be that layer. What we say is, your data is already with you. Let us help you make sense of what that data means. So for me, I think that's going to be a big space. Second, I also think with the advancement of AI, preventive care is going to get even better. Today, I met someone who was talking about it's a company which is into predicting dementia using AI. Pretty cool. It's just a bunch of small tests you do literally on the computer or on the phone, and it gives you an assessment of whether where you stand on dementia. And I think these are the kind of things that can, somebody tells me, is it medical grade accuracy? And I say it doesn't need to be medical grade accuracy, because they're not telling me that this is the final system, but at least it gives me an idea of, could I be on the risk, in which case I probably need to intervene. So I think that's where AI is going to take us. I think it's going to be faster care, more insights, more awareness across everybody. And I think the quality of care is going to go through the roof. What we achieved in the last 20 years, I think we'll do it in the next 2 or 3 years.
Incredible. You heard it here first, people. But medicine as a partnership. Wouldn't that be nice? Okay, so Rohit, real quick before we wrap up, how can our listeners learn more about SabaiHealth or reach out or any of that?
Great. Thanks a lot, Hunter, first of all. So you can hit us on SabaiHealth.com website. I'm very active on LinkedIn, so you can always connect me on LinkedIn. We are looking for ideas. We are looking for new solutions. We're looking for new partnerships. Our model is very simple. We don't build if we don't need to build, because that's the fastest way to get to the market, because we believe it's a GTM. So there are certain core stuff we build, the rest we partner. The same with our people. We're a completely remote team. I actually have 3 people in the US working for Sabai. We're a Southeast Asian company. So we have somebody in California. We had somebody in New York. Our AI security guy sits in New York, actually. So we're a completely remote company. So when we don't have skill sets, we go wherever. We have somebody from Cyprus who's on the psychology side. She just finished up. So we kind of can go where we have to go to find the people. And yeah, so that's the lay of the land.
And where should they go to buy your book? The
Great. It's on
Simplicity
Amazon.
Trap.
It's on Amazon worldwide. Simplicity Trap is on Amazon worldwide. So yeah.
Very good. All right. Well, once again, that's Rohit Nambiar, founder CEO of SabaiHealth. Rohit, thanks for being on.
Thank you, Hunter.